Hi guys, this video is about peritonsillar abscess, also known as Quinsy. So this is an acute pus collection. Where is the pus collecting? The collection of pus is in the peritonsillar space, which is the space between capsule and superior constrictor muscle. So this is a tonsil and this one is the capsule of the tonsil and this one is a superior constrictor muscle. So it is this space known as peritonsillar space which causes peritonsillar abscess, and this usually follows an acute tonsillitis. So this is a complication of acute tonsillitis, and here the tonsillar crypt are affected, and which crypt? Mostly the crypta magna, the largest crypt of the tonsil is affected, and when this crypts are affected, it can first cause intratonsillar abscess, and intratonsillar abscess causes burst of the capsule which can later spread to this peritonsillar space causing peritonsillitis, which will eventually result in quinsy or the peritonsillar abscess. And doing culture, we can see there can be a mixed growth of Streptococcus pyogenes, Staph aureus and anaerobes. So this was about the etiogenesis, and mostly they are affecting the adults more than children. Mostly it is unilateral and occasionally bilateral. Now coming to the clinical features. So divide it as general and local features. General features are due to septicemia, and there can be fever of 104 degree Fahrenheit, chills, rigor, malaise, headache, body ache, nausea, constipation. And local features can be remembered by POPFET. What is POPFET? First there is pain, word pain, severe unilateral throat pain. Then odynophagia. It's so marked that the saliva dribbles from the mouth and it can lead to dehydration. Then there can be hot potato voice, that is muffled and thick speech, foul breath due to the sepsis and poor oral hygiene, earache due to the 9th glossopharyngeal nerve referred pain which supplies both the tonsils and the ear, and then can be trismus, which is the spasm of pterygoid muscles. Now coming to the examination features, remember it by cult. What is C? Congested tonsil pillar, stop palate. Uvula is swollen and pushed to the opposite side. L for lymphadenopathy, that is cervical lymphadenopathy, mainly the jugulodigastric nodes. And torticollis, that is a patient keep the neck tilted to the side of abscess. So this was all about the clinical features. Now coming to investigation and treatment, what we have to take is a CT, that is contrast enhanced CT or MRI, to look for the extent and also the abscess. Then do a needle aspiration for taking material for culture and sensitivity. Now, what we have to do? First, we have to hospitalize the patient, give the IV fluids to combat dehydration due to the odynophagia. Now, give large IV dose of antibiotic of both aerobic and anaerobic organism, analgesics like paracetamol or pethidine, and avoid aspirin because it can cause bleeding risk, and in children, it may cause Frey syndrome. Then, oral hygiene. For that, we can give H2O2 or saline mouthwashes. Now, if it is not relieved by medication, that is, if it is a frank abscess, we have to do incision and drainage. And where are we doing? We will do the incision and drainage at the point of maximum bulge or the junction of anterior pillar and uvula line. So, lateral to this junction, we will do the incision and drainage. And after 4 to 6 weeks of incision and drainage, we can do interval tonsillectomy. Then, there are some people prefer doing abscess or hot tonsillectomy instead of IND, but this is controversial as during the abscess episode, if we will do tonsillectomy, it can lead to higher risk of rupture and excessive bleeding. Now coming to the complications, this peritonsillar abscess can spread to the parapharyngeal space and can cause parapharyngeal abscess. It can cause edema of the larynx, for which we have to do tracheostomy. It can be septicemia causing nephritis, brain abscess, pneumonitis like lung abscess, jugular venous thrombosis, and spontaneous hemorrhage from carotid artery or jugular vein. So this was all about peritonsillar abscess or Quinsy. So if you want this note, you can check the Telegram channel. Link is in the comment section. So, thank you.